Welcome to the latest episode of our podcast, MQ's Open Mind. Again, Craig and I are delighted we could do fantastic guests. We've got Mariana Bolivar, and Mariana is known to Craig and I very well because obviously she works with MQ, but we'll hear more from Mariana in a second. And also we've another guest is Thomas Hackman, and Thomas is currently in the Netherlands, I think, but we'll hear about his PhD work shortly at the University of Oxford. So welcome, Mariana and Thomas, to the podcast.
Thanks for having me, Rory. Great to be here.
Thank you.
And so maybe, Mariana, maybe kick off with you, because you're obviously known to us, but maybe not known to all of our people who listen to the podcast. We always start the podcast. The focus of this podcast, for those who are tuning in, is looking at really the relationship between the internet and mental health, and so more broadly. But before we get into the nuts and bolts of the podcast, Mariana, can you tell us a bit about your journey into mental health research? And obviously you've been with MQ now for a few years. And so maybe tell us about your journey, that'd be great.
Yes, of course. So I've been at MQ for 4 years now, which it's now a long time. And my background has been in global health and international development, and a little bit of work with the applications of digital technologies in this field. And at MQ, my role has been focused on driving lines of research that have to do with the wider determinants of our mental health, how aspects in our society, in our economic systems, and now in our digital environments, which is a part of our world now, how do those things affect our mental health, and also how our mental health can in turn affect or influence all of these factors, both from ourselves, our personal conditions, but also in the wider society. And this is how this project of the internet and mental health came into place.
Yeah, indeed. No, thanks, Mariana. And you just mentioned there that one of the reasons of the podcast, or the impetus behind the podcast, is you've been working with Thomas. We'll hear from him in a second, looking at the relationship between the internet, digital harms, and obviously mental health, and particularly apt as we obviously in the UK have recently, through Parliament, obviously online harms bill and so on has moved forward. Thomas, same question to you though, before we get into the details, is tell us a bit about your background and the work that you've been doing.
All right, sure, yeah. So my background originally comes from psychology. A funny fact is that both my parents are psychologists, so I have been fed psychology from a very young age. My original interest was neuropsychology, looking at the development of the brain, particular focus on neurodegenerative diseases. And then at some point, I started getting interested in more of a social psychology subject, which was for me, what is the internet doing to us collectively and individually? What is spending all this time mediated by technology, be it video games, social media? What is it offering us in terms of risks and harms, but also benefits? And that brought me to the Oxford Internet Institute, where I've now been for the last 5 years doing research in this field, most recently looking at video games specifically.
Great, and we'll hear a bit more about your work, I assume, as we sort of dissect the research evidence. So Mariana, come back to you then. So tell us about the project. This is an MQ project. What's the where did the project come from? What did you hope to achieve? And then we can go into the details about the specifics in a second.
Yes, of course. So it's an MQ project, which we started acknowledging, as Thomas was saying, that the omnipresence of digital technologies in our lives. So we wanted to understand this link with mental health, but furthermore, because there is so much debate and conversation in press in different aspects of the harms of how is it good, how is it bad, we wanted to know, based on good research and scientific evidence, what do we really know about these links. And well, we took the ambitious scope of the whole internet, so that includes social media, gaming, artificial intelligence, access to information, and so forth. And besides compiling what do we know from that, we also wanted to imagine how things can be better, and not just focusing on all of the harms and how it can be bad, but also how can we make technology safe and healthy and empowered. Oh, sorry, and I forgot to mention, so we are working in this project with the University of Melbourne, with Origin, that they conducted the literature review of longitudinal studies, and they are experts in young people's mental health. And of course, as we started this conversation with Thomas, we saw like that link on, and yeah, we are then collaborating in this.
And who was leading the work in Origin?
Joe Robbins.
It was Joe Robinson.
Yes.
Okay, great.
Mhm.
Yeah, Joe does fantastic work. Okay, so then the
And
next,
Bridget Kenny.
and sorry, who else? Sorry?
Bridget Kenneth, that she conducted the literature review. I should
As well.
mention.
Okay, great, fantastic. So is this review, is that project finished though?
Yes, so we already, so the project has 3 phases. One has been the literature review. Second, we conducted some consultations, including young people, researchers, people from the private sector, and technology developers, to discuss these issues and how can we do that better. And then on the 3rd phase, we really didn't want to just make a report and publish it and that's it. We want it to be used. So we have been working with different actors at the global and local sector to make it come to life, to understand what do they need. So right now we are in that process of finishing the report that is going to be published, and starting to analyze and use those learnings.
Okay, fantastic. Then Thomas, back to you then in terms of, so what do we find in terms of the top line question we're often asked, or we often hear discussed in the media, is the question is, well, is the internet harmful to young people's mental health? What does the evidence tell us?
Oh,
Just a small question for you there, Thomas.
That's an incredibly huge question, as you can tell. The internet is a very big, multifaceted space, right? Like commerce happens there, socializing happens there, gaming happens there. So when we talk about what is the effect of the internet, we will have to probably zoom in on people's individual experiences. Like also, what does their users look like? Then the other hand of that question, what is the effect on people's mental health? Even that, especially also young people, takes many different forms and shapes. The only way I could answer a question that is that big is probably by likening it to, a diet. Like, what is the effect of calories on your health? And the answer would be, well, that depends, that depends on how are you, like, what are your macronutrients like? And does that fit to your life or lifestyle that you desire? And so the same would be for internet. You can overconsume on a lot of different things that happen, in the digital world. People can spend too much time on certain applications, or people can experience harm through certain usages of the internet, undeniably so. But on average, I would say the effect of internet on mental health is probably not that harmful. There are very serious, grave harms perpetrated on the internet, but then you're looking into like specific, parts of that.
Mm-hmm. Okay, so let's zoom in, because that's a great answer to really get us going. Is that okay? Of course, we have to. The internet is this massive, as you say, it spans all aspects of life. But if we then zoom into where we hear so much of the media coverage, and maybe Mariana, do you want to kick off on this bit on then the role of social media? So we'll come back to be interested in maybe 2 particular aspects. One is social media and mental health, and the other maybe is looking at gaming and mental health, because obviously we get the growth in serious games and ways of not just, as we said at the outset, obviously you're looking not just, Mariana, at the harms, but looking at how we can harness things for the good as well. So Mariana, do you want to then just kick off maybe with what the evidence tells us on the relationship between social media and youth mental health? Because I know the focus of the report, I assume, is on youth, given Origin's involvement. And then, Thomas, you can come back in with add bits to that, and then we'll move on to the gaming stuff. So Mariana, do you want to kick off?
Yes, of course. And well, one of the advantages of looking comprehensively at the internet is that we could recognize that regardless, well, in different activities, the harms or the potential harms and the benefits are similar. So regardless if it's, for instance, in all internet activities, one of the potential harms is addiction, like behaviors and compulsive use. Another one that is across activities is the cyberbullying and exposure to harmful content, either if it's violence or inappropriately sexual or from everything from human trafficking. But in general, what we see of mechanisms of harm is this compulsive use, potential social comparison, the algorithmic effects on our decision-making and our behaviors, and cyberbullying. And in terms of mechanisms of benefit, what we have seen is, well, the access of information in social media and in gaming and others is the access to social connections and peer support and feeling empowered by the tools of the internet to explore curiosity, skills, even leisure, because we have to understand that also for young people, like play is an activity, and it can be a good activity, as Thomas was saying. It's just not, things are not good or just bad. So that's a little bit of what we have learned in terms of potential harms and benefits. And well, I've talked a lot, but maybe after I can give you a little bit of comment on what we have learned from social media. I think that's.
No, that's great, Mariana, obviously highlighting the nuance, obviously, in the debate. Maybe Thomas, and then going into a bit more detail then on the. So somebody said, my understanding of the literature is that the relationship between social media and mental health, youth mental health, is, first of all, it's complicated. Secondly, my understanding is that any effects that are evident are modest, and that most of those effects, of course, they'd be modest, but devastating on some individuals who are already vulnerable. So is that a correct interpretation of literature, or do you want to provide more? It would be great if you could provide more detail.
Yeah, you're right on the ball, Rory. That is where the literature currently stands. So the big studies that have been done about the effects of social media on mental health do consistently, on a big population level, find slight negative associations. We have to be careful in interpreting that cautiously. We have to be cautious in interpreting that causally.
Yeah.
But these effects are about the size of having an unhealthy diet is on your mental health, wearing glasses is for your mental health. So we're speaking about things that aren't like big determining factors in whether or not your mental health switches from one state to the other. That being said, that is on a population level. Anecdotal evidence, more qualitative research has certainly found that people can also experience like big harms in social media. And there are also particular vulnerable populations when it comes to social media. One that the news often mentions is young girls. Here, the harms to mental health often are related to social comparison, or indeed kind of sexual exploitation or grooming practices at the worst. What you have here then is that there is a part where people truly suffer, potentially even because of social media or the interactions on there. But on average, most people manage to balance it and are fine with it. Still doesn't mean that on self-report skills, they say that they're happy with it, because there is also this underlying thing of, is it useful time spent on social media or on the internet more broadly? People might still rather be doing something else, but it might not be negatively influencing their mental health, particularly if they're using it as any other leisure activity. And the alternative would be watching Netflix, reading a book, or another like hobby, instead of, for example, exercise or sleep, or things that, the literature knows are very beneficial for your mental health.
And then that's really helpful. So do we have any idea, though, in terms of other populations that are vulnerable?
I would say within every population, of course, like no one is immune.
Yeah.
for the dangers of the web. Other populations that are vulnerable would be LGBTQ communities, although they also have, there are studies that have shown clear benefits, particularly for these communities, because internet places, especially video games, can operate as a safe space to explore with different identities, genders, or other kind of like personalities that potentially you couldn't do, in your quote unquote, like real life back at home. Of course, there are other communities as well. And then I'm thinking about other minority communities, different populations all across the globe that are not kind of, the dominant, the dominant group.
Yeah, no, because obviously there's been competing narratives, obviously published recently in the popular science literature in terms of the evidence for and against. And I suppose when the field that we work in, or I work in suicide prevention, is for me the issue is the debate. We've lost all nuance in the debate, and although I firmly believe we need to be regulating social media companies, we need to make sure safe material is presented, and we don't have algorithms that put you down this rabbit hole of despair and disaster. But there is a really important but is that's often then used as a get-out clause for governments. Obviously, I can understand why the government has supported regulation, and I supported it as well. But often it's a get-out clause of if we're looking at mental health, the determinants of mental health, as we well know, are multifaceted, cross-life, cross-generation. And I think too often, social media has been used as a scapegoat to explain declining mental health in young people, and it's so much more complicated than that. And although, yes, so don't get me wrong, of course we need to regulate and keep places as safe as possible. That's only one small part of the complex puzzle of understanding young people's mental health. Maybe on that note then, Mariana, and again on this positive note, and then I'm going to come back to Thomas when we ask about the evidence for gaming, which there is obviously no growing evidence for some positive benefits. But Mariana, in terms of your reading of literature and involvement in this project, then what does the evidence tell us about the positive benefits of the internet, of social media in different populations?
So from the positive angle, as Thomas was saying, there's this part of, especially in young ages, of exploring an identity, of developing curiosities. But and this is like, I'm cautious to say this because there's some evidence about it, but we still really don't understand. But there is this hypothesis of the rich gets richer. So essentially, when you have a fulfilling life offline, when you have a wide range of fulfilling offline activities, social life, I don't know, hobbies, and so your social media or your online activities become an expansion of that fulfilling life. When you don't have that, and particularly for young people from marginalized or underserved communities that have less access to entertainment options, or that are not socially skillful, then that starts to create vulnerabilities. And that goes to Thomas' point, that is not social media causing something, but there are underlying things on the offline world. And also just in terms of social media, one aspect that was helpful to know is research can help, like practically, to put limits to those harms. And one example that we explore in the report, and I just wanted to mention, particularly because it relates to young girls, is that after finding that there's a link between the use of dieting products and the development of eating disorders, then Instagram banned the advertising of dieting products to under 18s. So those are limits based on evidence that we can put, and we can do more of that to understand what are the boundaries.
Yeah, no, that's good points. The earlier point there reminded me, your first point reminded me a bit of when Craig and I interviewed Alistair Campbell, the podcaster and mental health campaigner. Is Alistair Campbell talked about, when he thinks about his own mental health, he talks about this having a jar, and basically when you've lots of things in your jar, it's jam jar, right? So he decided he was using it to explain the multifactorial nature of mental health. And he said at the very bottom of the jar, you've maybe got your genetic influences. Then you've got, your lifestyle stuff, your diet. doing exercise, in his case, going whatever wild swimming, spending time with family and friends, having a project he's really involved in. But the point he was making was, what you're trying to do is grow the jam jar, is effectively what he was saying. And I suppose that sort of came to mind when you're chatting about if you already have awful stuff going on in your life, and then awful stuff then also happens in the internet, or you have the absence of more protective factors potentially, then obviously the risk of the internet or social media grows. So that sort of struck me as you were speaking there. Don't know how good a comparison that is, but anyway, it came into my head. Thomas, back to you then. I'm going to ask you a couple of questions. One is maybe on the gaming work, because you've been doing work on gaming. And so for those people who are unfamiliar with how you go about studying, investigating that, can you tell us what you've been doing or what the evidence has told us? And then how we can harness gaming for the good, as well as always hearing about gaming being a link to internet addiction and so on.
You've already used the word scapegoat. And I think when it comes to digital technologies, gaming often has become arguably the biggest scapegoat of them all. In America, in the American media at least, it has often been blamed for causing violence. School shooters always played Call of Duty, for example, or any other kind of shooting game where they must have learned, how to be violent. But it's not true. The science has shown over and over again that being exposed to violent video games or violent content does not make you yourself violent. Everyone in Japan also plays Call of Duty, but there hasn't been a shooting ever, I think. So these, especially video games, not just for violence, but also for addiction or other kind of negative things, video games have often been blamed. That has kind of created a tricky situation for research where before, because games were shown in such a bad light, the gaming companies who hold the data to study these phenomena also weren't that interested in participating in research. And I think over the last 10 years, that has really changed. So in our research, we are working together with all the big gaming companies right now, not just the publishers, but also the platforms. So you'd be thinking about the Nintendos and Xboxes to study what real gameplay behavior and actual objective playtime does to players' mental health. Before we started these collaborations, we just had to ask people, how long do you play? And how does it make you feel? And we and others have found that people are not really good at accurately remembering how much time they spend online, especially if they're in these immersive environments like video games where, there's this whole concept about flow, but people lose track of time. And what we have found is that on average, the amount of time you play does not seem to be a good predictor of your mental health. The quality of your play seems to be that. So it depends again on people personally. If someone has, 5 hours available to play, they can play and be happy with that. If someone has 2 hours to play, they can do that. If someone does not have time for play and therefore doesn't play, they're probably less happy than someone who has time available to play and chooses play, as their leisure activity of preference. This is in contrast to what I have first said about social media, where there is the consistent slight negative association. Here we find either a null association or a positive association on average.
And what outcome measures are you tend to be using in those studies?
We're looking at life satisfaction, subjective well-being, measures of addiction and dysregulation, and a whole bunch of others. We're looking at sleep measures as well. We're looking at time displacement measures, like what else would you be doing? And personality and depression indexes as well. We try to go as wide as we can.
And across all of those indicators, there's either this positive effect or no effect at all.
I mean, that's not for everyone. That is
on average.
Yeah, that is the average result. Yeah, of course, there are people who struggle. Of course, with all those things, life satisfaction, well-being, depression. But on average, on the population level, we see no clear negative effect at all. No.
Just to pivot slightly, so talking about gaming, so that's one of my main hobbies. So what I've seen over the last decade is that there's been a rise in mechanisms that's been involved in the game kind of landscape. So in terms of the rise of microtransactions, so if anybody doesn't realize, but it's more spending small amounts of money on, well, I guess at first it started with like cosmetic items, and it started turning into actual things that you can use to kind of get ahead in gaming. And also the rise of stuff like loot boxes, which was essentially like gambling but aimed at children. Is there been any like research or anything that's been involved about that aspect?
Well, before you answer that, Thomas, what is that? Loot boxes, did you say?
Yeah, so I'll explain loot boxes. Loot boxes
Yeah.
are the digital equivalent of what buying a pack of trading cards was, kind of offline. You buy the pack that has a chance of having a special card in it, a special Pokemon card, or just more the kind of common ones. But the problem here is that you do not know what you're paying for, but it could have a slight chance of something pretty epic. This is pretty much akin to gambling. Like you're spending money on you do not know what. And especially for games that are like played by young people, this is incredibly problematic because gambling is something you can only start doing as an adult. Even then, gambling research has also shown that gambling is not on average good for your mental health. So then to have kind of these like similar practices in games, I think is problematic, and the science has shown that too.
And then go back then to the sort of evidence then, right? The take homes thus far then, as far as I understand what you've said then is, both of you, is that the evidence for gaming and mental health is positive or no effect at all. And then with the social media, although of course it can be devastating impacts on some individuals, on average the effects are small or modest and are similar in size to the impact of diets and so on your mental health or well-being. Now, so if that's a correct understanding of the broad literature on those two areas, I suppose my question to both of you then is, if you had all the money in the world, right, what's the one question that you'd want to be addressed in the sort of broad sphere field of internet, harms, benefits, mental health?
Right, unlimited money, like the actual social media companies of today have. I would want to get a representative population. So all these questions we are studying on the ones we can reach or on the ones who are on these platforms. And there are so many like under-marginalized minority communities around the world that simply we haven't even studied yet. And to get a good answer to any of the questions that we want to know, we need to not just study the kind of convenient samples of the West. That's where I would take it.
Yeah, that's a great answer. Mariana, same question to you.
So first of all, I do share with Thomas that the point is that since we have found we need longitudinal data, and all of these platforms, what they have is longitudinal data from huge samples in the world, but this data is not shared with independent research. So that is one thing, and I would use that data to understand how we can build the algorithms that are going to drive our digital future in a compassionate way. So that algorithms themselves are compassionate in terms of having the capacity of recognizing suffering, try to avoid it, do actions, and they are not just, and that technology is not just designed to trigger all of our vulnerabilities for profit. So yes, I think that I would invest. That was a slightly longer answer.
That's
like incorporating compassion into algorithm intelligence. I think that would be the short version.
Yeah, no, I think it's really, really important. But I suppose that leads me on to another interesting question, which is, what else do we think social media should be doing to protect young people's mental health? And I assume there's recommendations in the report around this. So who wants to kick off on that?
I think the first step is what Mariana just said. The social media companies should open up their databases to independent research. Before we can take action, we need to know what is the real effect. And indeed, all this data, all this online behavior, all this time spent online has been stored by these servers. And right now, this data is used to optimize algorithms to sell more advertisements. But this data can also be used to study online behavior and its effects thereof. So I think that's step one. Are we tiptoeing step one, step two, or should I just take over, Mariana?
No, you continue, I'll go after you.
Right. Well, and then if we have, the tech industry opening up its data to independent research, then independent research needs to look at that, but not alone. Like they need to do that with practitioners, families, and youth themselves to start integrating the lived experience of then how this is integrated in people's daily lives and the outcomes from that. And I think after that, policy will need to listen to the evidence base that's being formed to produce evidence-based like regulations for the technology industry.
Mhm.
So it shouldn't be one based on stigma or kind of like political waves of, fear or anger. It should be a collaboration between all these parties. And then these regulations, one example would be a duty of care for social media or like technology companies, in the sense that if they are the creators and moderators of these digital spaces where youth and children, spend their time, then they should have a duty of care to like minimize the harms that are perpetrated or created in these spaces. Other things that, might be helpful are a certification, like for developers who work on spaces for youth. Right now, these are made by, brilliant coders and developers that are given by a metric to optimize for by, a business department of one of these companies. And that metric will probably be user engagement or spending. So they're creating spaces for youth, where youth try to develop identities, where they try to socialize, where they find access to information and, try to navigate the world. But what they are building these spaces for is not to, further those causes. It's just to like try to consume as much of their time or money or data as possible. So I think the people developing these spaces should probably kind of be certified like any other profession that works with children, be that teachers or caregivers or something like that. They should, I think that would be another great thing to implement, to start making these spaces like safer for youth.
Yeah, no, that's a great answer, and such an important answer. And as you say, because in any other setting, there will be some requirement, there will be some check that you're meeting some minimum standard. Mariana, anything else to add to that?
Well, those responsibilities that social media companies or like tech developers in general have, or the private sector have, is soft responsibilities. So there's a responsibility to promote and to try your best, but essentially, if you don't, nothing really happens. Or even when fines are done or legal consequences are designed, they are so minimal for the power and the resources that these companies have that it becomes really pointless, because if you can pay a fine and keep doing what you're doing, you're just going to do it anyway. So that is one thing, like I would work on the enforceability of that. But also we know that it cannot, by prohibitions and regulations, you can only do so much. We really need to explore ways to use positive engagement strategies so that people are drawn to whatever activity came, not through their vulnerabilities, but more like feeding on a desire to be better people, to connect genuinely with others, to learn, to other things, we need to tell also the private sector, what can you do instead?
Yeah.
And make that enforceable. Also, another point that I wanted to make related to the enforceability is that most of the recommendations about how to make the internet safer, and they put the weight on carers, on parents, on the individuals, on schools, when it's really, we need to focus more on the systemic things, the technology itself, the economic models of our digital world, and not just in small things like the social media, the screen time. Those are really not the right questions.
Yeah, I suppose we should be more focusing on not just the economics, but the well-being economics. I mean, in terms of trying to, that should be prioritized. Because as you say, the big tech companies aren't incentivized sufficiently. They're so vast that, as you say, a small fine is such a drop in the ocean for them. Okay, so we have a couple of last questions. Can we try and squeeze in a couple of last questions before we bring it to a close? Okay, the first one is trying to be more optimistic in terms of how we can enter take-home messages. So start with you this time again, Thomas. So can you tell us, like, what can advice to young people out there or families out there? How can people stay safe in the internet, or what can they be doing to promote safety?
Yes, I do think safety should not come from like the end user, but should be built into the system and built into society. But of course, that people should also be able to, you know, take measures into their own hands, and you're not powerless in this. I think that one of the key take-home messages when it comes to, you know, digital use is quality, not quantity. So, which means that you should think, what does this bring me? What am I doing? And am I enjoying it? And that will probably also naturally then start limiting the time spending if you kind of like repeat those questions. The second point would be, take a holistic approach. Don't hyper focus on digital media usage or screen time alone. Like, see how this technology fits into your life and what the behavioral trade-offs are. What else would you be doing if you wouldn't be doing, you know, something online right now? And the third one, also for especially young people, but I think it applies to everyone, is that, you know, talk to those around you, you know, that you trust when it comes to online experience. Talk to parents, talk to friends about anything that, you know, looks odd, feels out of place, or you feel like you are losing control of.
Okay, great. No, that's really wise, practical advice. Mariana, same for you. What else would you add?
Well, I think Thomas just mentioned everything. The only thing that I would add to that, for young people, for families, for schools, and everybody else, is just to really join advocacy efforts. Amnesty International, for instance, they have very important, very well evidence-based advocacy campaigns for digital rights, and I would really encourage people to join those advocacy efforts.
Okay, great.
There are also things you can do when it comes specifically to the technology, right? Like, there are apps, like, basically you can, in a way, fight technology at their own game, you know, where they are trying to make these apps as seamless and as smooth as possible, you know, as low friction as possible. They're on your phone, colorful notifications. When you're in, it immediately tells you like this and this is happening. You can kind of do the opposite. You can install certain apps that, for example, allow you to take a deep breath before you open Instagram or something. And I have found, if people want really concrete little quick fixes, that something like that helps people, because by adding back in that friction, it gives you a moment to think, do I want to be using this app now, or am I doing so out of habit, or because the app told me by means of a notification or something that they want my attention? So if you kind of, you know, create that little bump again, you are forced to just think for a minute, or not a minute, for the time of one deep breath. Am I, you know, in agreement with this, or actually do I not want it? So things like that can help as well.
Excellent. That's a great way to sort of bring things almost to a close. Let's see, Mariana's trying to come in again.
Yeah, sorry, I was just going to mention one thing, and it's just, that we will show through the report, but also through the conversations that we've had in this project with different people. What we have discovered is really that there are very good examples, just as Thomas said, of like how technology can be good. To the report, we are going to see examples of, of collaborations between Save the Children and with Pi, that is an artificial intelligence assistant with emotional intelligence incorporated in it. We're going to see advocacy efforts. So we do want to show that things can be different, that there is a way, that there are people and organizations trying to do things right, to not give like a very pessimistic scenario of the digital future.
Okay, now that's an important point to almost bring it to an end. That's twice I've tried to end this podcast, and twice both Thomas and Mariana had loads to say. So no, that just illustrates how much there is to talk on this topic. Okay, so just before we bring it to, I just ask one last unrelated question, which we try and just end on a sort of upbeat note. But before I do, is any other key message that either of you would like to convey about the relationship between digital harms, mental health, the benefits of the internet, or whatever it might be, before we bring it to a close? Anything you'd hope to have said or been asked but haven't had the opportunity? Thomas, anything your end?
I would say, think about your use like a digital diet. You know, with your diet, you're always thinking, how much fat do I need? Protein, carbohydrates. And it depends kind of, you know, are you running a race the next day? Are you trying to lose weight, gain weight? Are you exercising or not? Too much fat is bad. Too much protein is bad. Too much carbohydrates is bad. Too much of anything in the digital world is also bad. And you have to figure out, when does, you know, consumption on internet become overconsumption? And when should I like tone it down and find ways of doing that? That's my take home.
Nice, a nice take home that. Marianne, any take home from another final take home from you? You don't have to have, because there's one other question as well.
Mm-hmm. Well, no, I would just emphasize on the point that we need to, on the role of mental health research, of helping to design technology in a healthy way, and so it's for humans and not only for consumers.
Excellent. That's a
Yeah. If I can add to that,
am I ever going to get this podcast finished? Right.
Sorry.
Right. Go, Thomas, quickly. I'm running late for my next meeting, but you've got 2 minutes.
Sorry, because that one was for people, for like the general population. The other important take-home message is, we cannot study this as scientists if we do not get access to the data that companies hold. And if scientists cannot study these questions, policy cannot create evidence-based policy that really, you know, improves mental health and tackles the harms. So it all starts by, you know, the willingness of these private entities to start working with scientists and the people to really study how we can improve this.
Okay, brilliant. Such an important point. Right, I'm going to try again to bring the podcast to a close, right? So, okay, so we have this unrelated question. So, Marianne, I'm going to ask you this question just to try and just a nice way to end. So the question is, if you had the opportunity to have dinner with any historical figure, who would it be and why?
Well, probably there's a more interesting answers to this, but it's just because we have been like talking about the integration of compassion into algorithms. I would say Buddha to understand
Buddha's a good,
how compassion works and how can we actually implement it. So I think that would be.
Yeah, that's a great answer, Mariana. And Thomas, same for you.
I am shocked that was going to be my answer. I cannot believe that. Okay.
Are you being serious? That was going to be your answer.
Yeah. All right.
No, you're not invited to my dinner. You just do it.
No.
You have to find your.
I mean, you know, maybe he would be fasting anyway, and he doesn't want to go on the dinner.
Who's your second choice then? Your second choice, Thomas?
Beethoven.
And why? Why?
Someone who has made music so timeless. I wonder what it was like, you know, in his time. Was that the pop music of today?
Yeah.
I do. That's what I want to find out.
Yeah, it's a question I've often wondered myself as well, when I think about the Mozart and Beethoven and whatever.
Okay, so I will invite you to my dinner, but if you also invite me to your dinner, I would like to know that.
On that note, on behalf of Craig and I, huge thanks, Thomas and Mariana. That was a really fascinating discussion. And Mariana, last question for you is, if people want to, when's the report out and how can people get access to it?
Thank you. So we are publishing it in mid-September, and we are going to be disseminating in social media, and everybody who can use this work, understand how is it applicable at MQ, open to start conversations with anybody who wants to join our efforts. We are very fortunate to be working well with Thomas, with Amnesty International, with PwC, with the Heart. So we are really trying to gather efforts and that we are aligned in this.
Okay. Well, thanks a million for that, and a huge thanks again to both of you. So, and hope to our listeners, hope you had enjoyed that really important listen. And again, keep an eye out for the report in September. All the
Thanks a
best.
lot, Rory.
Thank you, Rory. Thank you, Craig.
Thanks.